And now we're on to the award for Best Community Organisation in Social Prescribing. This is kindly sponsored by the Conservation Volunteers in the People's Postcode Lottery. So we'd like to welcome Darren York, Chief Executive of TCV, who will introduce the finalists and announce the winner.
Hello, I'm Darren York, Chief Executive of the Conservation Volunteers. We're a UK volunteering charity that connects people in green spaces to deliver lasting outcomes for both. We've long been fans and advocates of social prescribing, and I'm really pleased that thanks to support from the players of the People's Postcode Lottery, we're able to sponsor this year's award for the best community-based organisation in social prescribing. And here are our finalists. Focal Project and Green Social Prescribing, Kirklees Metropolitan Council, which brought groups together again at a community centre with a project to grow vegetables. The Active Wellbeing Society, Birmingham, which has bridged the gap between the health and community sectors. And Wellbeing Matters, Salford CVS, where the pandemic has encouraged new meeting places, online and in green spaces. Now let's hear a little more from each of them.
Growing Focal is a growing group that's based in the Linley area of Huddersfield. We started it during lockdown. The idea is to have it's a social thing. You don't necessarily have to be into gardening.
We've got a beautiful herb garden which is now vastly overgrown, and that's there for people who are walking past who might decide that they want to have some salmon and some tarragon.
So the feedback has been they feel a lot better, they look forward to coming, it's taken care of, they have a point to get up and come here in the morning. We've got some lovely quotes.
It has been important to come out. I was getting really depressed, and I come here every Wednesday now, and it really books you up.
Meeting everybody out in the fresh air and growing food we can eat. It's helped with my mental health a lot. Just meeting the same group of ladies every week has really helped.
I've been involved with this from the beginning, and I don't shed a tear very often, but I've shed a couple of tears here.
I'm Kieran McKenzie, I'm the Head of Social Prescribing and Lifestyle Services at the Active Wellbeing Society, and I'm joined by Naeed Akhtar, one of our senior link workers. We deliver a social prescribing programme in over 50 practices in Birmingham. By creating activities in and around GP practices like this one, from carers groups to walking groups and a range of other peer support interventions, health centres have become community centres, connecting patients to support for non-medical issues that affect their health. We work with communities and primary care to achieve system change, moving towards universal personalised care, where patients have the power and involvement in the design of services available to them. We also offer a volunteer pathway for patients to develop skills and lead future sessions themselves. The pandemic has changed the way we work, but our mission has remained exactly the same, and that's tackling health inequalities and supporting patients to live well. We adapted and flexed our service model to include telephone support, befriending and virtual activity, alongside delivery of face-to-face interventions and outdoor activities. We are so proud as a team of what we've been able to achieve. We have continued to be a lifeline for people during their most difficult times in their lives.
Hi, I'm Nick from Wellbeing Matters. Our aim was to realise the vision for people, families and communities at the heart of health and wellbeing in Salford. To do this in a city with some of the worst health inequalities in the country required much more than a social prescribing approach alone. So Wellbeing Matters has three aspects: a Salford-wide social prescribing approach that we call Community Connecting, investment in volunteering and community organisations, and embedding wider social value. The VCSE sector developed a partnership approach with delivery of social prescribing by community anchor organisations, which is underpinned by development workers to support the capacity of community organisations to receive referrals. It also improves the use of green and blue spaces. There are funds attached to the programme, providing grants of up to £15,000 to community organisations to receive referrals from our community connectors. This has enabled us not only to provide new opportunities for local people, but also reduce the pressure on our colleagues in primary care.
And now to reveal the winner. The judges were impressed by all the nominations they assessed, and after careful consideration, they decided that the winner is Focal Project and Green Social Prescribing, Kirklees Metropolitan Borough Council. Congratulations and well done.
Hi, we're Growing Focal, and as we're a growing group, we're freezing outside. I'm Lisa from Local Services to You.
And I'm Chris, the facilitator.
This award is for the people who attend the group. We just facilitate the relationships, the interactions and the new friendships.
We're an amazing group here at Growing Focal. On behalf of everybody who attends our amazing little project, we'd just like to say,
We're chuffed to bits! Let's get more growing spaces!